Welcome, everyone. I'm excited to welcome you to this episode of the Sunflower Palliative Care Podcast, a podcast exploring all aspects of children's palliative care around the world. The Sunflower Podcast brings curiosity, humor, and reflection to the world of palliative care. We are exploring the joys and challenges of working in this incredible field, including topics related to education, advocacy, self care, service provision, and leadership from around the world. Whether you are a nurse, counselor, pharmacist, doctor, or any other type of healthcare provider, or just someone who's interested in learning more about children's palliative care, then this is the podcast for you. I am Spandana Rayala, a guest host for this episode, and today I'm joined by Basma Ismail, Taiba Borhamah, and Sara Zayed from the Community Engagement and Volunteer Department from the Kuwait Association for the Care of Children in Hospital, known as KACCH, and Bayt Abdullah Children's Hospice, known as BACCH. So let's get started. I see a lot of smiles on your faces, and I remember one very impactful and one very successful event that you have done recently called Heartful. Would you like to talk a little more about it? How did it come to be, and how can other people do something similar to that?
Yeah, so Heartful, it was an idea that, was in our books that we would like to collaborate with the local art community and bring the local art community to Bayt Abdullah, not only to raise funds, but also to raise awareness to this group of people in Kuwait that can also open lots of doors for us and lots of collaborations. The idea was initially that we reach out to the local community, see who would like to contribute an art piece so we can hold an art exhibition here in Bayt Abdullah. And in a way, we're bringing people here to the building so they know that we exist. Because as Taiba said before, like until now, even though we're doing so much on ground, you can still, get to be on an accent, what Bayt Abdullah is or what the KACCH is, and they would say no. Heartful was the first charitable art exhibition and auction that we hold for KACCH and BACCH. We reached out to two artists. I think it was last August.
Yeah, it was in summer.
Yeah, it was last August. So initially we had a curator in mind, we had a meeting, and then, it didn't work because of other commitments. So we're just going around and around trying to find someone who can curate for us because neither of us had any experience about that. And we ended up with a very talented and beautiful person called Mahala Tekir, who connected us with another artist who agreed to support with the curation, was Yusuf Abdul. And then from their side, they started reaching out to all the artists they know. Wow. To donate a piece of their artwork so we can display it here in Bayt Abdullah to raise funds and to raise awareness. And not only that, so they took it, they have to take it up a notch. So they said, okay, so why don't we organize workshops with the kids so we can create a couple of pieces where we can auction. It was purely their idea. So they ended up connecting us with 3 different artists to create flower fossils on clay.
Yeah, with
right?
the arty.
Yeah, with the arty. We created cyanotype pieces. It's printing with the sunlight, with Huda Bilmomi. And the last workshop was fabric printing with actually one of the curators. He works as a creative artist and fashion designer. And he ended up creating 3 beautiful pieces with the kids that were auctioned on the second day of the exhibition. It was our first trial, but it was a huge success. We definitely created the buzz we wanted. So many artists in the art community know about us and they've connected us to more people. Now we have a running list of artists who are wanting to do workshops with our kids here. We've already collaborated with one. And I think there is a second one who's going to do a workshop for our ED patients for Ramadan. And it's going from there. And now we're thinking, hopefully, we're gonna create Heartful 2.0 at the end of this year.
Wow. I think I heard the number that you have raised, and it's not a small number.
No, it's not.
A lot of the programs in the world, their annual budget is less than what you raise. So definitely it's a lot of money.
Keeping in
And-
mind that money raised was with zero cost, so all of it was through sponsorships and donations. So we work in a hospice. We don't have a gallery, so we had to actually transform offices, like legit offices, with like library shelves into adding gypsum board, and all that was funded by either the manufacturer of the wood or one of our long-term donors, like actually a financial company. And then all those tiny pieces of the exhibition and auction itself, purely either sponsored or donated. So raising, can we disclose the amount?
Sure, yeah, we could do this.
Yeah, I mean,
Of course.
yeah, so raising around 23K with zero cost, I think is a big effort from our department, from the organization, from the artist, and then from the volunteers.
Yeah,
Yes, try.
yeah. Yes,
Yeah.
definitely. That's why I said formidable women. And 23K Kuwaiti dinars is close to, I think, 70,000 or more US dollars. So it's definitely not a small amount. And as you said, it's also the social capital, the awareness, and also the continued collaborations that you build from it, for which there is no price tag to.
So if you don't ask, wouldn't have happened. So she asked, and then she reached out to the first curator on social media. And we were sitting there for 2 weeks, waiting for her to respond. And one day she showed up in the office. She was like, Maha responded, and she's in. I'm like, oh my God.
And it all got connected, like in such, again, just from personal acquaintances, meeting with them,
Yeah.
them mentioning 5 names, actually talked this one name, and then kind of just going from there. The money I'm like raised and awareness raised, my brother actually told me this, where maybe this is locally, and I think this also translates globally, but again, I think it's always under the theme of for people to care.
Mhm.
Doing all of that. So like we've done Ramadan campaigns before. Like Ramadan is a month, a holy month for us here, where a lot of people are very generous in that month because it's just kind of going back into the values of what we do for that month. Where of course, we've had success and everything, but I think the physical presence of bringing people to the actual place, seeing them in their eyes, doing all of that, like kind of if you walk the day in Hartsville, you see there's a lot going on. So there's the silent auction, there's the live auction, there's the gallery, there's the merch, there's the wish tree, there's the art curation of just the children's painting, there's a tour, there was catering, there was a lot going on. And so one of my family members was saying, you work here now since 2021, and I've personally, he's like, not for any other reason, but I've never donated. Like I've never thought of it, although I see on your story like the link, and it's very easy, very accessible. It's just literally a click of a button. But he said it took all of that for me to come here, and I actually contributed a lot. Like he bought 2 paintings, and he bought like merch, and he was saying that's funny enough that that's such the human condition. For me to care, you had to create
For yourself.
like Heartsful. We had to create a Heartsful for someone to actually finally maybe, I don't know, contribute.
And also to remember that there was a lot of noise out there, social media, websites,
Yeah.
newsletters, and all these things. And people don't know where to give, and they don't know which are the honest places and which are not. So kind of showing them the physical place, the actual work makes the difference. And how do you do that? Through events and social, creating that social space where they can come and interact, where they don't feel threatened by a lot of sad stories, but could see the good impact.
I also, Dr. Spandana, would like to highlight one very important point. I think behind our success and what we do also, that we have to be flexible. And it's also not our flexibility alone, but also the flexibility of our leadership. Because I mean, you have to work around things a lot, and you have to be open to doing different things. I must also say that our founder, Mrs. Margaret Ismail, and Dr. Tela, our CEO, they were, a huge part of the success of this campaign, because, allowing us to use the space downstairs to turn it into, I mean, the initial plan was maybe we're gonna use the chalets. And then, going back to Miss Margaret and discussing that, and she was like, no, it's a patient space, you cannot touch that. But how about doing that with KACCH office? And then going to KACCH office and speaking to Nasser and, our colleagues, Tamer and Helen, who are sitting there and like, we're gonna use this space, given that they were not very happy at the beginning, but after they see the event and coming and seeing this for their eyes, they understood and they appreciated what we did. So it's the flexibility of the leadership to give us the space to fulfill our vision. And then, the working with our colleagues as well is a huge aspect of why this eventually worked.
There's so much to take away from here, and I'm making mental notes. I'm learning so much.
I think also one of the things we had to do, at least I felt that when I looked at the space before it was built, before it was the exhibit, I felt there was no way this was going to be an art exhibit with like 9K pieces.
Yeah.
But you have to trust the curators. We trusted them, and they delivered with like an amazing, beautiful walk, and like the whole experience was was flowing so nice. So you walk in, you check the art pieces, you walk out, you check the merch, you check the artwork of the children. It's all so smooth, and it's all like the vision of the curators.
My 8-year-old wanted to buy everything.
Yeah.
It was truly also magical to see like the use of art is maybe not particularly, nothing really had something with an IV or with like anything medical, but for the purpose of bringing back those funds for hospice and hospital. And then also, like Sara mentioning, like there was a 9K piece hanging there, and the way the volunteer was like explaining to the donor that eventually, ended up donating for it, and kind of all those like mini efforts that were happening. There was like a place where we curated the artworks of children, and one of the volunteers took it upon herself to analyze those paintings and started to explain to the donor, so this child perhaps drew this painting because he was feeling it, kind of again always bringing back the story.
Yeah.
And there was a volunteer who is promoting rocks painted by
So everything just became an opportunity. Like, what can we bring out? So and it was a lot of
people buy now.
donate now and follow now, and they were like our community ambassadors. They were truly like a force. Yeah.
This sounds like a Shark Tank or Dragon's Den episode where you are selling your startup idea. Wonderful. I hear a lot of laughs and a lot of stories here. What are some of the most enjoyable parts of your work? Some of which you have already mentioned, but also what are some of the most challenging parts of your work?
So for me, the most rewarding part is actually knowing what we're doing is making a difference for a certain child or a family. And this happens when we hear feedback directly from the family or through our colleagues in the hospitals or here. Or actually when for me, what melts my heart is when a child sees me and they actually miss me and they are happy to see me. I feel like I have this special connection with them. And now, if I'm on holiday or on leave, I feel bad if I'm missing an event.
It's like, send me pictures. What's happening? I'm like, that's why we're trying to run the event. I can't do it. I'm like, okay, I'll send you everything she wants to know. And
We call this FOMO.
she feels that way.
So we have this connection with them now because we see them so often. So we built. I see that happening for all three of us. We know the families, we know the parents, we know their stories, we know what they enjoy, what they don't enjoy. So this is definitely very special to me. What's most challenging, operation perspective, it's, having to juggling, our responsibilities, the planning of the nitty-gritty, the meetings, it's crazy in our department. And we've only spoken about events that we do for our patients and their families, but we're also involved in, events that are educational events that are happening here when we coordinate with the clinical department or psychosocial department, or if we have a special visit with the leadership and we have to be involved or coordinating photo ops for donation. So our schedule is busy 7 days a week.
I know if a child family is facing trouble with finances, we are like, call Basma, call Taiba, call Sara. Or someone passes away, what next? Call the department. Medical student day, call them. So for everything, we keep hearing your department name coming up so much. I can only imagine the stress you must be under.
Yeah, so this is one aspect, operation, and of course, I find it most challenging when we work with a patient and we have this special relationship and unfortunately lose them. But I think this is something that we all share, and we have to deal with working in a hospital setting and working with oncology and hematology patients in the hospitals. I think this is very challenging for me, especially when we all also have our own personal experiences and, you know, baggages that we have from our personal lives. So, you know, you'll have to have those couple of days until you accept that this is life and, you know, you have to move on, and at least you've done your part, you know, contributing a bright day or two for this child, and you move on.
Yeah, and also how do we keep honoring kids who we are losing and whom we have formed bonds with? So that's, I think, the other part. Anything that you both find challenging, Taiba, Sarah?
Something that I find sometimes challenging. So logistically, you have to really, at least in events, so each event has to be creative. Each event has to be completely different than the other event. So children, they're aware, they have certain expectations. So we have to like take it up a notch every time. And I think that's a fun part, and that's also a challenging part at the same time. I need to add to Basma's part. So sometimes when you see a patient and then you can kind of see them deteriorating, it kind of breaks your heart, especially when you've seen them, for example, they were well, and maybe they relapsed. They were enjoying the events, maybe now they can't anymore. Maybe they're admitted to a hospital. So it's a bit like challenging to deal with. But we try to take it like in a positive way. Maybe sometimes we do their last wish, or maybe sometimes we do something in their hospital, maybe decorating the room or something. So we try to make it positive in a way.
Yeah, contribute somehow.
So I think we're kind of just sharing the same experiences, right? Because we used to work in the same department. I think like the most rewarding part, I would say. So like kind of signing up for this job, like back in, like you would kind of imagine it like a desk job, right? Like, okay, I'm in that type of field right now, but then you're not technically, because we do deal with children a lot. Maybe like that's not really that expected in different organizations, but here. So kind of, let's say, I remember one specific time frame where it was like, and we had like a big gap of events. We hadn't had one in like a couple of months for various reasons. And when we did kind of go back to seeing those children that we haven't maybe seen them in like 2-3 months, I remember being like, and that's why we do what we do. Because maybe like, and I always think of like the admin area where they purely do have maybe more like administration jobs, and they of course they know, like I've heard from facility, like any nail I put, I know it's going back to the children. They understand, but it's, at least from my perspective, it's so different when you see it. And like I've had like the fathers of patients come up to us, and the way that they are just thanking, and we don't want those things for like, just please enjoy. Say things like, you made me understand the value of a child because of the details that you put in an event. And maybe that's not what they're thinking of right now because they have a sick child and they're thinking of hospital and how to kind of care as they should, but kind of remembering that. And then they would actually reflect back on their childhood, and no one thought of what we do for fun, and you are, and they really put an emphasis and really remind me of kind of what we do. So I think that's always a very special part. I'm very, very grateful for having that. And then I would say like the challenging part, truly is kind of going through that with a patient. And then it's never easy, and like kind of and you'll always have that one first patient and kind of your experience there. I don't know, it's very hard to talk about.
Yeah. And also having those remembrance days every year and letting the families come back if they choose to. I think that is one other thing that you guys do.
Yeah.
And I think that's very heartening to see that so many families over the years have keep choosing to come back and visiting Bayt Abdullah and share that time with us.
Well, I'm happy to tell you, Dr. Spandana, also that now we extend our events in Bayt to a number of our Bayt families who expressed interest in attending those events for their now children.
Yeah, a lot of times healthy siblings are the ones that are forgotten through the illness, and also even after during the immediate grief and bereavement period. I think having access, these reminders, bring your children here, giving them some sense of normalcy in their lives. I think that is great.
A challenging part maybe, and I think we all share, and because we're all trying, like I think we're fine with maybe our family. So I think because the way we operate, and because sometimes you're contacting like a vendor that might have different working hours, or you need an answer for someone for tomorrow's event. So maybe willingly, I would say from my part at least, we're always on the clock, I would say. And kind of I don't really have that like, okay, now it's 2:30 or tomorrow. I feel like it's just it's just like a day, and maybe there's a nap in between. It's not really like a night and day type thing where it is constant, and I welcome it, to be honest. It's not anything from I think it's just more of my part of trying to, I think it's because we care and we want it to be executed. Yeah, we really want it to be executed in that, like Sarah said, next time it's over the top and more, and kind of how can we add that? So it's just always, I think, constant, which is it's working because it's helping it, but maybe it is a challenge of our family is not appreciating it that much.
Yeah.
But yeah.
That's what I was thinking. I think I myself would be very appreciative of it, but I wouldn't glorify it probably on your behalf, because I can see I cannot do that with my own commitments. So I don't think your families would be able to sustain it much longer. So how do you develop systems? But I think you're on that way.
Such a social butterfly, as I told you. So she would be having events here, and then she's volunteering in 100 other places. And then, I hear the stories, and then she comes and tells me about her time. I'm like, volunteer that much.
No, but yeah, I think we just have so much to give, and alhamdulillah, it's in this productive way. But yeah, it is a challenge. I will admit, and I think it's on our parts personally and nothing on anyone else, where it's just something where you care, but where does that for me just doesn't
Yes. I know you, Taiba. I think you do have to work on it, your New Year resolution at least. So now I want to ask you something very, very practical for the listeners to just copy and paste probably. If any of the listeners want to start from zero, wherever they are, to reaching wherever you are, but they still need, as you said, the admin support, leadership support. They need probably some resources, and they don't have access to it. What are some of the things that you can think that they can start with, like doable, sustainable things that they can begin with and slowly build on it?
I think my advice would be definitely see what you have working right now and step by step build on it. Definitely you will have to have your leadership support, but also, with nonprofits, you always have the issue of the money and funding your initiatives. So again, networking, trying to reach out to people, make your cause sound appealing, and be straight to the point as well. I mean, telling people that we work in a children's hospice and then list 100 kind of diseases that we're supporting is not going to mean anything to them. But as Taiba said, talking about stories, ways of acknowledgement as well, because, corporates and companies would like to hear about how they could be acknowledged. If someone helped, make sure to thank them by sending a letter or sending a trophy, sharing pictures. I think all of this makes a difference. But definitely, you cannot start with not doing any events and say, this year I'm going to have 15 events for our patients and their families, for example. I'm talking if someone is working in the same field. So definitely tag on what you have now and try to keep post at minimum, because even now, when we have our budget set and planned and everything, we still try not to make any budget spending if we can reach out to the community, because people eventually would like to help, but they need to know that they are helping a good cause, a reliable cause.
I think just kind of going back, like, where did we start? What was our zero? Kind of identifying your gaps. So not particularly that Bayt didn't have events, but like we kind of went through COVID and there was like virtual events. So kind of identifying that, like what are the patients or you as a nonprofit are missing, and then how can we, like as I said, start slowly and small and then kind of expanding that. And then of course, like learning by flexibility, I think is what we can kind of come out of this. Like hearing from them directly. Like I remember there's a couple of initiatives where we're having meetings and how we can do this. And then a parent would disclose that I would like to do this. And we kind of just like, right, like hearing from the source is directly like, what are they wanting? That's the gap. Something like, of course, you might have something. And then what are those really missing elements that are working right now? Because maybe social media wasn't that important 10 years ago, where everything was being made by other types of approaches. And now a lot of people answer my straight question in the interviews of how, and then they go like, yeah, was it real? Or was it TikTok? Funny enough,
Yeah.
or yeah, it was a sponsored like on my explore page, and kind of reaching from there.
Yeah, no communication, know your means of communication. Kuwait here is a very WhatsApp culture. So people won't answer you by email. I'm not talking corporates, of course. This is when you more of when you're reaching out to individuals, or actually certain individuals. So people would rather respond to you in WhatsApp than responding to you by email. So know your people.
Yeah.
Know how they would like to be communicated with or contacted.
Yeah.
Maybe from my perspective, some people, not WhatsApp, not email, you have to pick up the phone and give them a call.
Yeah.
So again, communication, know what works and what doesn't work.
And also, I don't use social media so much, but I always hear about updates about KACCH BACCH on Instagram from other people here, our colleagues.
Yeah.
So I know Sara is doing the social media part. Any thoughts on that?
So I think an important part is covering what we do. So I try to look at it as, what if I don't know what's KACCH and BACCH? So if I look at Instagram, does that really channel it? Like, do you understand what's KACCH and BACCH if you look at our Instagram? So I try to cover different topics like volunteering, maybe clinical, psychosocial, just giving like an overview of what we do and the services, and just to visualize. So sometimes based on our social media posts, we would get donors or we would get volunteers. So people really do look at our social media and just get inspired by it.
In other words, like you have to understand what is the popular social media outlets that you can leverage and utilize. Because, for example, here in Kuwait, it's an Instagram culture. In America, for example, I think it's Twitter more than Instagram. Maybe Instagram for a different generation, but here Instagram is very popular. In Egypt, it's Facebook, not Instagram. I think now more people are getting to TikTok. So know which is the favorite social media outlet for your regional audience. So here in Kuwait, we focus on Instagram because it's the most popular. And I think now more people are getting on TikTok. So we recently started our TikTok profile as well, where we highlight some of the events, some of the activities. So I think you have to be more specific on what you want to achieve. Build on what you have, build your process to achieve.
And also, I know you collaborate with a lot of Insta influencers to get the word out too. Do you think that helps in getting more followers? This is out of curiosity.
So we have reached out to Instagram influencers, but we are also very picky with whom we reach out to, because it's very important to be careful who you tie your brand with. We've had instances in the past where we had the opportunity to tie our name or our brand with fashion influencers, but we didn't believe that our ethos aligned. So yes, we've reached out to a couple of influencers here in Kuwait, but very targeted.
Yeah.
So I think you have to pay attention to this as well.
I have so many more questions because this is so interesting for me to learn personally. But Sara, were you about to say something?
Yeah, so sometimes it's not really the influencer. Sometimes it's, let's say we have medical students day, and then it's the students posting. So one time we had a viral video go around, and then we had a couple of followers just from a student filming videos in Bayt Abdullah, and like what it is, what are the services. And sometimes even companies, when they do, let's say, a hospital visit, and then they mention us, and then we get more followers and we get more awareness from people.
Before they say bye, because if not, I don't think I'll finish this interview today. Is there anything you want to share with the listeners?
I think I would want to say all the best of luck for anyone who is doing good to the world out there, whether you're working in a hospital, in a hospice, or a nonprofit. I think what you give is what you get, and good goes around and come around. And I wish them all the best. We are here. We'd love to connect. You can follow us on social media to see our latest updates at KACCH and BACCH. Our profile on all the social media outlets is at KACCH BACCH. Our website is www.catch.org. And through our Instagram bio, you can access our newsletter. You can see the latest. We are reachable at info@catch.org if you'd like to send us a question, connect about anything, ask about our insights, about anything related to community engagement and volunteering. We'd love to help. And thank you, Dr. Spandana, for the opportunity.
Oh, this is wonderful. So I'll just clarify. It's info@kacch.org. Any parting words, Taiba and Sara?
Thank you so much for this opportunity. We'd love to talk. Like I think a lot has been wonderful. Yeah. We can go on and on. I think it's also been very insightful, hopefully, like to the listeners and then also to each other. I think we work a lot together and we understand how we function. But also like kind of hearing things from my colleagues and being like, right, yeah, they feel the same. I think a lot of people also might feel the same within the same field, or even like could be in a different field, but kind of also have those challenges or also that kind of rewards. Thank you for allowing us the space to share.
No, thank you so much. I think you're some of the wisest people I wanted to interview from a long time. Thank you for listening to this episode of the Sunflower Palliative Care Podcast. These podcasts grew from the seed of an idea as we talked with our colleagues within the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Towards Cancer Collaboration, which focuses on children's palliative care. We hope to build a world where no child suffers from serious health-related suffering. To learn more or to donate, please visit the website towardscancer.ca.